Hello, this is Dr. Lewerenz at Longevity Health Institute in our Rochester location, Rochester, Michigan it is. Couple things that are new I want to share with you. Have a podcast and actually a book coming out soon. And as always, we have this newsletter that we produce quarterly. This is our winter and fall one. And this newsletter actually I cover things like the benefits of broccoli and how it's Mother Nature's cruciferous gift to us for hormones and detoxification. Talk about something I call drug muggers, where the certain medications rob us of nutrients and minerals and amino acids, and how important that is to be aware of what medications when you take them, what they can do, and how you need to supplement beyond that. We talk about actually something about it's new in Harvard studies on intermittent fasting for weight loss and longevity. Talk about head injuries, hormones, autoimmunity in your gut. We email this to all our patients. It's posted on our Facebook and on our website. And it's always, as always, bringing you new science, new data, new studies, and educating you, because knowledge is power, right? I've taught you hopefully that well. Something I wanted to talk about today is, unfortunately, I saw some cancer patients. Sometimes this gets brought up to me like, do we help, or what do we do with cancer patients, and how do we address that? So I believe in integrative cancer care. Integrative cancer care is very, very, very important. We don't negate anything with Western medicine and traditional approaches with cancer therapies. Albeit, though, we use things to balance and to monitor, and that's what I want to talk about today, about how we monitor a cancer patient for the effects of their therapy, whether it's radiation or chemotherapy, and how we can build up their immune system and what we can do to support them in their process of therapy and treatment. And I will tell you, in 20 years, I have seen people do very well with integrative cancer therapies. And I've seen people do occasionally well with traditional approaches alone. And I've seen people do semi-well or even poorly that just take alternative approaches. And a few of colleagues I talk to that do a lot of integrative cancer therapies, essentially the gist is we all agree that an integrative approach, the best of both worlds, treating specifically, targeting these rogue cancer cells, and using the best of advanced medicine, but also looking at somebody personalized, as we always do, what is our options to build your immunity and support side effects, and negate or try to avoid or dodge side effects of therapies is what's most important. Also, getting to the root issue and the cause of why at first you got cancer. Something I want to cover, though, is why and what we look at and what are some of the unique things we do with cancer. One of the things we always do is we want to look at tumor markers, and we'll draw tumor markers on you for whatever type of cancer you have that is reflective of whether it's head and neck cancer, tumor markers for lung and respiratory, digestive tumor markers, pelvic, endocrine tumor markers. But we'll follow your tumor markers pre-cancer therapy and during and post, so we can see where you're at in outcome. We also want to see that you have evidence, okay, that we can tell that your immunity is balanced. And if it's not pre-therapy or at diagnosis, how can we manage and build you up? What supportive things can we give you? So very often we'll do a test that is called your Cd4 Cd8 ratio. It looks at your natural killer cells and your natural suppressor cells, and your helper cells, your helper T cells. And basically these are ratios that we look at it to make sure that you have an immune balance. And if you're in immune suppression, what we can use then, and what we see proof, whether it's IV vitamin C, whether it's injectable peptides, whether it's nutrient buildup, whether it's gut health and restoration, whatever we're doing for your therapy, that we're building you up, but that we see a result with your immune effects and immune support. The other thing that we'll often do is, and I believe in, whether it calls for it often or not, we are not going to wait for a problem or wait for where we're at in your therapy. And this may not necessarily follow traditional approaches, but I often believe that when cancer therapies are done, they look at 5-year survivals, and 5-year survivals are important, of course, because you have to have data that you follow these things, but you also don't want to wait for these rogue cancer cells that potentially are floating around, that if you're not doing something proactively, even proactively and vigilantly monitoring, you don't know, okay? And then 2, 4, 5 years later, another cancer, or you get a reoccurrence. So we'll use PET scans that often use a sugar as a sugar marker that is your cancer taking up these cells, or these sugars into cells. So cancer loves sugar. It only can survive in a sugar environment, and most cancers can only survive in an anaerobic hypoxic environment. So this is why oxygen is good for cancer, and this is why low sugars, whole food diets, raw diets, low animal and low carb diets, and that support your immune effects in reducing the angiogenesis or spread, if you will, of cancer cells. So you don't want sugar in your diet, but we also, when we test you, we're testing to see that if we give you sugar in an IV, where is that lighting up in your body, and is there any evidence of any of these rogue or any of these random cancer cells that are potentially still around. You still need a good foundation. Remember that. Your immune foundation is your gut and your diet, and your immune foundation including your nutrients, okay? But it's also stress effects on your body. And one thing that I'm a big proponent of, and I talk 3 times a day with some of my cancer survivors and cancer fighters, okay, and they are all like this, is this. Your head's got to be in the game. Positivity and how you think, optimism, and where you're headed and going in a positive way supports your immune system and can heal your cancer, okay? Remember that. Walk out of a room if you see a physician that tells you that you have a short time to live, because they're doing you no service and doing you no good, okay? Of course you need integrity and honesty, and things need to be forthright. But remember that the way you believe and the way you think and the positive nature of your thoughts, and this is done by studies. Bruce Lipton, a PhD, is an excellent PhD that has studied this on genetics, DNA, and animal studies about how we are affected by our emotions and by our thoughts and by our external environment with a cancer cell. So you want to fight and beat and win the war of cancer, you need to be positive, be energetic mentally, be hopeful, optimistic, and you want that support system around you, and you must believe it, because it is true. You can beat this and win this and fight this battle. So my patients that have cancer and have had these diagnoses, unfortunately, the ones that do the best, and here's my take-home message, take a whole approach. Western medicine, Eastern medicine, they clean up their diet, they eat low sugar, they eat raw, they eat whole, okay? They do some integrative therapies, okay? But they also are very positive, forthgoing, knowing that they're beating this, and they have a very positive, supportive environment. And anything that's negative in their world at that time, they get out of, whether it's family, friends, job, anything, physicians, anybody that they're seeing that is negative in that realm, it's not supporting and helping you at all. So I hope this educates you a bit. I hope it's somewhat enlightening. We're always here to support therapies integratively and work with our oncologists in that, in helping patients with cancer and helping prevent cancers. And we're all about wellness and personalized medicine and functional medicine. And we're all about knowledge, giving you knowledge that it's going to help you thrive and not just survive. So hope this gives you some information that you can find useful. Spread to others. Be grateful. Have a lovely evening. This is Dr. Lewerenz, Longevity Health Institute. Be well.